Okay, so we have blood pressure, and this again is measured in millimeters of mercury. Blood pressure is what causes the blood to move through your vessels, a difference in pressure. So blood always travels from a high to a low pressure. When we're talking about the blood pressure, it depends upon whether or not the heart, the ventricles of the heart, are currently contracting or whether they are relaxed. So when you have systole, the ventricles are contracted, and this is going to mean that the blood pressure is going to be higher. When you have diastole of the ventricles, then the ventricles are going to be relaxed. Okay, so that is actually the reason why we have, when we measure blood pressure, why we have two different pressures. So blood pressure is typically measured in the brachial artery, although lately when I've been going to the doctor, they put the blood pressure cuff on my wrist, right, which is a different artery. It's the radial artery. But the brachial artery, that is the one where they put the blood pressure cuff on your arm. And what they're doing there is they're actually collapsing the artery so that no blood is flowing through. And then as they release the pressure, they're listening for the first sounds of the blood, and it's going to sound like it's going to make a noise. It's going to sound like a little, right, in when they're listening with the stethoscope. And that is the systolic pressure. So what that is when the ventricles contract and the blood is first able to get through the blood vessel. And then when you stop hearing that sound or you stop seeing the little movement of the dial on the blood pressure machine or the cuff, then that is where the blood is finally able to force its way through the vessel. And so that is what is called the diastolic pressure. So this is actually kind of the limit to healthy, normal blood pressure. If you have blood pressure that's higher than this, then you are said to have hypertension. And that can actually cause damage to your blood vessels. And it could also damage the heart, and it could also damage the kidney. And so having high blood pressure, chronic high blood pressure, is very dangerous. When we look at how blood pressure changes, we can see on these graphs, this has blood pressure versus blood viscosity. And these are in the arteries. So these are the ones that are close to the heart, where the heart is pumping the blood out. And so you can see here that in the arteries, we have a pulse, right? So we have a change in the pressure. And if we partially collapse, say, for example, the artery in our wrist, we can actually feel that pulsing of the blood. If you were to cut an artery, that actually causes the blood to spurt out. And so a severed artery is a spurting of blood. Whereas, for example, you'll notice in the veins here, they do not have that, the differences in pressure. And so it's all under low pressure and relatively low velocity. And so you would just have a slow bleeding of a vessel if you cut the vein. You'll also notice that pressure and velocity stop really quickly at the capillaries, because remember, the capillaries are very thin and they have a very small diameter, and that is going to increase resistance. And so that slows the blood back down. And then you'll notice in the veins, we have low pressure. And remember that we have some mechanisms to counteract that. And that would be that the veins have valves, and they are also associated with skeletal muscles. So if you move, then that is going to, the contraction of the skeletal muscles is going to actually help move the blood back up towards the heart. And so if you sit for long periods of time, sometimes you can get pooling of that blood in your extremities, and that could be very dangerous over time because it might lead to blood clotting.